Dr. Khoo, can you please explain what atrial fibrillation is?
Atrial fibrillation is one of the most common heart rhythm disorders that we're encountering now. 1 in 4 individuals that are older than 40 years old develop it, and it becomes more frequent as we get older. And this is in comparison to 1 in 8 women developing breast cancer after 40 years old. So that's how common atrial fibrillation is. There are many risk factors that make you more susceptible to developing atrial fibrillation: obstructive sleep apnea, which we have discussed before, diabetes, hypertension or elevated blood pressure, valve disease, a previous heart attack, having had heart surgery, smoking, obesity, again results in increased workload of the heart and long-term increase in pressure exerted on the atrium. And having high doses of alcohol can also cause atrial fibrillation.
Well, do you know if you had it? Can you feel it?
Well, the most common symptoms associated with atrial fibrillation would be the feeling of rapid, irregular heart action. It can go very fast, and if it's prolonged, it can make you feel very tired and fatigued. Some people get very dizzy when the heart rate is very fast. It can go up to 200, 240 beats a minute. The older you are less likely to go that fast. Having atrial fibrillation puts you at risk for developing a stroke. That is because in atrial fibrillation, the top part of your heart, the atria, is not beating, it is quivering. And when it's quivering at 300-400 beats a minute, there is no heart pumping or significant blood flow. So when the blood pools, blood clots can form. For somebody who comes in with a stroke and does not have a real cause, about 40% of the time, that's due to undiagnosed atrial fibrillation. If you had long-standing hypertension, at some point you will start developing premature atrial complexes. And as you monitor that over time, the frequency of the PACs increase, going from hundreds to thousands, and from thousands to tens of thousands. So initially they will last for seconds, but eventually the seconds become minutes, and the minutes become hours. And if you still do not treat it or try to retard the progression, the hours become continuous atrial fibrillation.